I'm looking for a sign. Are you the sign? Okay, great. Thank you. Good afternoon, everyone. It is good to be here on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. I'm joined today by Public Health Officer Dr. Bonnie Henry and Minister of Health Adrian Dix. And before we get into the substance of today's announcement, I just want to say again how grateful I and all British Columbians are to those who have been, for the past number of months, working so hard to protect people and property right across British Columbia through yet another absolutely horrific fire season here in BC. It's certainly challenging. This is the fourth year of this government, and this is the third summer of record-breaking heat, record-breaking fires, and these are challenges that we are prepared for because of the hard work of people in every part of the province. So to the crews, to Emergency Management BC, to Indigenous leaders, to community leaders who've all been stepping up to do their part to engage in this challenging fire season, as well as all of the other issues that are on our plates, I want to thank you from the bottom of my heart. And in saying that, though, although we've had a bit of a reprieve because of the weather, we're a long way from out of the fire season. Currently, significant fires in all parts of British Columbia, here on the island, in the interior, getting certainly a reprieve in the north for now, but indications are that we have several weeks to go. So people, please be vigilant, listen, be attentive if you're in a fire area, to those around you, to emergency personnel who are there, of course, to make everybody safe. And now, of course, I want to turn to the objective of our conference today, and that's to talk about where we are in the COVID-19 pandemic. Minister Dix and Dr. Henry have already advised that it's quite unlikely, in fact, it is not likely, that we will be moving to step 4 of our restart plan come September. The Delta variant and an increase in cases, largely within the unvaccinated population, has led us to pause and reflect on what steps, what measures can we take through public health and through other initiatives to protect British Columbians, to protect businesses, and to make sure that we can keep doing, to the best of our ability, those things that make life here in British Columbia so special. Getting vaccinated is the way forward through this pandemic. We have outstanding numbers. Minister Dix will go through this shortly. 3/4 of British Columbians eligible, 12 and above, have had 2 doses of approved, safe, and effective vaccines. Over 82.5%, I think, have already had a first dose. And today, we are announcing the initiation of what we're calling the BC vaccine card, to make sure that when you go out to non-discretionary activities like ticketed sporting events, indoor concerts, movies, wherever there is non-discretionary activity that you can go to with the confidence that those around you have also taken steps to protect themselves and their families, the BC vaccine card will help us get there. This gives people time, as we start with a target date of September 13th, to implement the BC vaccine card with an end date of October 24th, plus 7 days, to ensure that the vaccines, the second vaccine for those who have not yet had their immunizations, will be safe to go into the broader population. This is a step we believe is important at this point in the pandemic, and Dr. Henry will go into some of the details. But there is no reason why those who are anxious to participate in the social and economic life of our community can't take that next step and get that safe, effective vaccine. They're free. We have clinics around the province. There will be more opportunities through pop-up clinics, through walk-in clinics, to make sure that that decreasing number of people who have not yet taken advantage of this opportunity will do so. And when they do that, that will give them opportunities to go to nightclubs, to go to restaurants, where I have to say, and it's critically important at this point, in our consultations with the business community, those who provide services to people, restaurateurs, the hospitality sector, tourism industries that have indoor activities, sporting events, cultural events, arts events, All of them want to make sure that they can continue to provide quality entertainment, quality services for British Columbians, and they want to do it in a way that gives their patrons confidence that they're taking every step possible to make sure that they can attend an event, they can go to a spin class, they can go out for dinner, and not be fearful that they may come into contact with someone who might be able to transmit COVID-19. The BC vaccine card is following in the footsteps of other jurisdictions. I've spoken to Premier Legault in Quebec, who was an early adherent to a passport, an immunization card in that province, and we've learned a great deal from their implementation, and of course other jurisdictions will learn from the work we do here in British Columbia. British Columbians need to know that this is the first time anything like this has ever been tried. There may be bumps along the way, but we're very confident. Minister Dix and his team have been working with citizen services throughout the summer to make sure that technologies can be ready to go. In September, Dr. Henry and her team have been making sure that we're doing this in a way that keeps everybody fully apprised of the state of play as we go forward. So with that, I'll turn the microphone over to Dr. Henry, and she can fill in the details.
Thank you very much, and good afternoon. So as the Premier indicated, I also want to begin today by recognizing everybody in British Columbia who has taken that important step of protecting themselves and their family and their communities by getting vaccinated to help us get through this pandemic. We've come a long way since this pandemic began 19, 20 months ago, and over the past 18 months, we have pulled through these challenging times together, and we need to continue to recalibrate, to look at what's going on around us, and to take the necessary actions to get us through this next phase. And as we have been through the last year and a half, 2 years, we do it as a province united, with compassion and with kindness. And British Columbians continue to demonstrate their strong resolve to put this behind us. Thankfully, we have a powerful and effective tool now that helps us on this journey, and that's vaccinations. Not only are they very, very safe, but they provide protection to you, to those who you are closest to, your loved ones, and your community, and allows us to get back to those much needed social interactions and connections that we need. Vaccines have changed the way we deal with the pandemic and have made it possible to remove restrictions and get back to doing some of those things that we love. And we've seen that. We've had that opportunity over this past few months of the summer, even though we've been faced with other challenging situations that have made it more and more difficult. And while we are making excellent progress with our vaccine efforts, we continue to see waves of cases, particularly in people who are not yet vaccinated. Over the past month and up until the end of last week, people who've not been fully vaccinated account for almost 90% of all of our cases and over 93% of the hospitalizations that we've had in this past month. To put it in context, we have a rate of about 28 per 100,000 cases in people who are unvaccinated, compared to 2 per 100,000 in people who are fully vaccinated. What that tells us is that your risk is 10 times higher if you've not been protected through vaccine. And what we are seeing is that leads to transmission in clusters of groups of people when they come together, particularly now that we are seeing transmission with the highly transmissible Delta variant across the province. These numbers are a stark reminder to all of us why vaccines matter. And we have made incredible progress in our shared efforts to put the pandemic behind us. High levels of transmission among unvaccinated people mean that further action is needed to help reduce transmission, to keep all of our businesses open, and ensure we can continue to enjoy the social events that we have been able to through the summer as we head into the fall. The science is clear. As I said, unvaccinated people are at a more than 10 times higher risk than vaccinated people. When you are vaccinated, it means that you are less likely to get infected. If you are infected, you shed virus for a shorter period of time, you're less likely to transmit to other people, and you're much less likely to have a severe illness that leads to hospitalization. And we've seen that that protection is remaining strong when we look around the world and here in BC. Which is why these new measures are now needed to ensure that as we move into the fall, as we know that our respiratory season will be ramping up, and we can ensure indoor social settings are as safe as they can be for the vast majority of us who have been immunized. The best protection as well of those who cannot yet be immunized, particularly children under the age of 12, as they head back to school in a few short weeks, is that all of us around those people are protected. That means we stop the transmission and we protect children as well. So a new provincial health officer order will require individuals to provide proof of vaccination, our BC vaccination card, to access certain social, recreational, and discretionary events and businesses throughout the province. As of September 13th, you will need to have at least one dose of vaccine to enter these settings, and by October 24th, entry to these settings will require people aged 12 and older to be fully vaccinated at least 7 days after receiving both doses. So the settings that we're talking about include indoor ticketed sporting events, indoor concerts, theater, dance, and symphony events, indoor and patio dining in restaurants, nightclubs and casinos, fitness centers, gyms, and businesses offering indoor high-intensity exercise, organized indoor events like weddings or parties, birthdays, conferences, and workshops, and indoor organized events, discretionary organized indoor recreational classes and activities, so things like seniors classes, choirs, and other indoor groups. These new measures will help reduce transmission and keep our communities safer and ensure we can continue to keep businesses open, continue to have those social and arts and sports events as safely as we can for those who are protected. There will continue to be many ways for people to receive their first and second doses of vaccine. It's quick, it's safe, it's easy, and it's the best way we have to protect yourself and your community, and to be able to continue to participate in these important social and arts and sports events. So I encourage you to visit gov.bc.ca, Vax for BC, to find a clinic near you. This simple act will make all the difference, as we know it is the way to stop the higher transmission that we're seeing with the Delta variant across the province now. So this, there will be more details about how to access your BC vaccination card, but just be assured it is a confidential system that will allow you to download onto your phone the card that indicates whether you are partially vaccinated, fully vaccinated, or unvaccinated, and businesses will be able to, will be required to look for your vaccination card and your proof of identification, as we do for many other things if we're attending a concert or going into a liquor store, for example. So that is there will also be provisions for people who don't have access to a phone to be able to do this through our call center, and we'll be ramping up and giving you the details of that in the coming weeks. So by the end of the long weekend, we'll have all of those details out for you. But this is our way of getting through this next phase of the pandemic that we've been dealt, and to make sure that we can go through the fall with safely reopening schools, safely reopening post-secondary education for students, for faculty, and to safely continue our businesses and events through the fall. We also need to continue to do those things that keep us safe, including wearing masks in indoor public areas, using hand hygiene regularly, and keeping our respectful distance from people. We need to, and we will be, continually reassessing and adapting as we go through this next phase and we deal with the pandemic cards that we've been dealt. This will be a time-limited initiative, and we'll eventually, as we move into the fall, we'll continue to work with the federal government to make sure we have an alignment with the federal passport, vaccine passport that's under development as well. But for now, this is what we need to continue to operate safely in our communities as we head into this next fall. And it will allow us to get through this with compassion and with kindness, as we have been doing all along here in BC. And I'll now turn it over to Minister Dix.
Thank you very much, Dr. Henry. I wanted to start by saying that our program, our Immunization BC program here in BC, is one of the most successful in the world. 83.2% of all those over 12, all those 12 and over, those eligible to be vaccinated, have been vaccinated. 74.9% have received both doses of a COVID-19 vaccine, and we're obviously very proud of that record. It represents 7,336,798 doses administered, and all of those doing that work, from pharmacists in the community to doctors and nurses and many other health professionals, to all of those supporting the efforts, we say thank you. And to all those British Columbians who themselves have stepped up in their vast majority to get vaccinated, and they get vaccinated again, we say thank you. Where we are in the pandemic, as I think was well summarized by Dr. Henry, that most of the recent cases we've seen and hospitalizations we've seen continue to be amongst unvaccinated individuals, who represent, of course, a smaller and smaller share of the population. In mid-August, the case rate amongst unvaccinated people was 10 times higher than the case rate in fully vaccinated people. Only 8% of the cases in hospital are amongst fully vaccinated people. What it says is there is a profound need for your health to be vaccinated, and that in the time of the Delta variant, being unvaccinated puts you, your family, and your community at risk. I wanted to note, of course, that we're at step 3 in our restart plan, as the Premier has said, and as Dr. Henry and I indicated last week. It is likely that we will not be moving to step 4 at the moment at September 7th, which was the earliest possible date we would consider moving to that step in any event. Today's action, this action around a BC vaccine card, is a key step in making sure that we continue to move forward in BC, that we overcome COVID-19 together, and that we move forward together. We know that the Delta variant is highly transmissible. We know that while so many British Columbians have had their first and second doses, there are British Columbians, about 776,000 eligible right now, who have not yet done so. We know that unvaccinated people are getting sick, and we know they are going to hospital. And we know that no one is comfortable with any of this, because throughout this pandemic, we've learned that climbing case numbers, rising hospitalizations, and increasing numbers of people in ICU is not the direction we want to go, or one that can be sustained. Our pandemic has always been about making good choices with the information we have, and making the best choices to stop the spread and keep people safe. And to make the best choices, we have always provided the best support that science offers and the clearest guidance it makes possible. That's why we're acting to ensure that as of September 13th, people will be required to be vaccinated to participate in a broad range of social settings and activities. These include, and Dr. Henry went through them, but it's important to through them again, indoor ticketed sporting events, indoor concerts, theater, dance, and symphony events, indoor and patio dining in restaurants, nightclubs and casinos, fitness centers and gyms, businesses offering indoor high-intensity exercise, organized indoor events such as weddings, parties, conferences, meetings, workplaces, indoor organized events, again, such as conferences and weddings. And by October 24th, to participate in these settings and events, people will need to be fully vaccinated. At least the first dose by September 13th, both doses by October 24th. And they'll have to do it at least 7 days before that, so important to meet those deadlines. Taking this action now is a critical step in continuing to increase the vaccination rate across the province. It's an essential step to provide increased confidence to fully vaccinated people that those around them are also fully vaccinated and have made the best choice in our BC pandemic and are also bringing us back together safely. Our BC pandemic has always been about taking thoughtful action and acting with precision. Providing advance notice of this measure to stop the spread, keep people safe, and increase confidence will allow those who have not yet got their vaccines to take the necessary action to do so immediately. And I want to say this, and as you know, this is an important opportunity, and across British Columbia, there will be the opportunities to do that. You can get registered today to get your COVID-19 vaccine, and I encourage you to do so. Online, people will be able to confidentially access their proof of vaccination. A secure web link will be widely communicated ahead of September 13th. And there will also, as Dr. Henry has said, be an option for people who can't access their record online. But let's be clear, to enter and access the settings we've mentioned, every person aged 12 and older must be vaccinated. And we all need to remember that getting vaccinated keeps everyone in BC safe and stops the spread of COVID-19. And getting vaccinated is the best choice to protect yourself, the people you love, and to ensure you can continue to participate in these settings and events. I want to thank everyone in BC for their continuing effort in this very challenging time of the COVID-19 pandemic. This is an action we can take together safely. I encourage everyone to take advantage of the opportunities across British Columbia to get vaccinated and to do so today. Thank you very much. I'll hand it back to the Premier.
Thanks, Adrian. Dr. Henry. And with that, I will also just advise the media that there will be full briefings tomorrow on with Minister Whiteside and Minister Kang with respect to K-12 and post-secondary. I know there are a lot of questions about where we're heading in those two sectors. That will be fully laid out tomorrow by the ministers responsible with Dr. Henry. Today we want to focus on the immunization card and what that means as we build the foundations for the tools we'll need and use throughout the next number of months to continue to move COVID-19 into the rearview mirror for many British Columbians, but still very, very critically important to those who have already been infected, those who've not yet been vaccinated. That's our focus today. And with that, I'll invite questions from the media.
Thank you, Premier. As a reminder to media on the phone, please press *1 to enter the queue. You're limited to one question and one follow-up. First question today is from Lisa Cordasco, Vancouver Sun.
Thank you very much. Since vaccinated people can also get COVID and also pass along the virus, why not, include another layer of protection by having a mask mandate?
Yeah, we know that it is much, much less likely, one, to get infected, and two, to transmit once you are immunized. But masking does play an important role in those areas where transmission in the community is high. And we've seen that in the interior. We're looking at what that means for us as we move through the fall. And we've seen transmission in pockets, as we know, in various places around the province. So some of that will be addressed in our discussions in the next few days.
Lisa, do you have a follow-up?
Yes. Will you extend this type of requirement to workplaces? Because a lot of people, going back to work are very concerned about having to work next door to somebody who has not been vaccinated.
Yeah, so these measures that we're introducing today are for people who are attending these types of events or businesses. And it is up to each business. The employer-employee relationship is a different one from somebody who is participating in an event or going to a business, a restaurant, for example. So yes, we have been working with WorkSafe BC to support businesses in looking at their COVID safety plans, the communicable disease plans, and where vaccination fits in those plans. And we've seen that from a number of businesses. We've seen commitments from the federal government around some of the federally regulated businesses, and we'll continue to support businesses who, particularly public-facing businesses, where vaccination is really important to protect staff. But this vaccine card is not for people who work in those settings. There's a different process that needs to take place for employees.
Next question is from Richard Sussman, Global News.
One of the challenges here, obviously, is going to be enforcement. Dr. Henry, you just alluded to the businesses will have some responsibility here. Can you talk about what we expect from a restaurant or a movie theater in terms of enforcing that someone has the proper identification, and what would the process be like if someone refuses, tells an 18-year-old server that they're coming in and they don't have proof of immunization with them?
I know these are the challenging things that we've been facing throughout this pandemic, but it is very much the same thing as looking at proof of identification of age to get into a bar or a nightclub, for example. So yes, we'll be working, and I know there's a number of ministries involved to support businesses in how to manage this. We're making it as simple as we possibly can to have a confidential way of determining people's immunization status. Mostly it'll be either by phone or by showing a paper copy, plus proof of who you are, so it'll have government ID as well. And yes, we do expect that there may be a small group of people who are protesting against this, as they have for other measures along the way. But we, as it is a provincial health officer order, we do have the ability to support businesses with bylaw officers, with environmental health officers, and we'll be continuing to work with them to support businesses in doing this in a way that's effective. I don't know if you want to add to that.
Richard, do you have a follow-up?
I do. I was also asking about, I'm just curious about exemptions. I haven't had a whole chance to look at all the details here, but if someone cannot be immunized, is there an exemption? If someone does not want to use the vaccine due to religious reasons, is there an exemption? And will there be exemptions for people traveling from outside of the province into British Columbia, or how do they follow the same guidelines as British Columbians?
Yeah, so the short answer is no. This is a temporary measure that's getting us through a risky period where we know that people who are unvaccinated are at greater risk of both contracting and spreading this virus. So if there are those rare people who have a medical reason why they can't be immunized, these are discretionary events that we're talking about. So they will not be able to attend those events through this period of time of high risk. There are no exemptions for other reasons as well. It is really important that what we're trying to do is be able to allow these discretionary events to continue in a way that is safe for the vast majority of people who've been immunized. In terms of people coming from out of province, we will have the ability for them to show their proof of vaccine, and it will be compatible with Quebec and with other provinces and what their proof of immunization or their immunization record is. So we have a process for that, as well as for international travelers who all right now have to show their proof of immunization using the Can Arrive app. So we're working with the federal government to make sure we'll be aligned with that as well. The only exemption I will say is children under the age of 12 who are not yet eligible for vaccination. They will be able to attend sporting events or go to a restaurant if the parents or the adults they are with are fully vaccinated.
Yeah, and just with respect to the intergovernmental connections here, other jurisdictions within Canada, other jurisdictions around the world, as Dr. Henry said, we've been working with the federal government, with provinces and territories across Canada to make sure that we are synchronizing this activity to the best of our ability. I think the vast majority of certainly British Columbians, 74%, heading to 75%, have already received 2 doses. So this is a majority view. And that majority wants to know that people that they're interacting with have taken the same steps to protect themselves and their loved ones and their communities. And that's the objective we've had at the national table with the federal government as well, of course, as with other provinces. And I made reference to Premier Legault from Quebec, who I've had recent conversations with about their experience. I believe Manitoba is already well underway. Other jurisdictions will be following suit. So there is, I want people to have confidence that we are coordinating as best as we can. The technologies do lend themselves to that integration. Again, the NavCan app to get into the country is the starting point for those that are not Canadian nationals, and those within Canada who are traveling will be expected to follow the same procedures as British Columbians if they want to participate in these non-discretionary activities.
Camille Baines, Canadian Press.
Hi there. Many youth seem to be really gung-ho about getting their first dose of vaccine earlier on as they were eligible to be vaccinated, but then they seem to be getting a little ho-hum about their second dose. Is that borne out by the numbers? Maybe Dr. Henry could answer that, or Adrian Dix?
Yeah, you know, I think there's a couple of things. Yes, we are seeing lower rates in youth, and they've had young people have had a shorter period of time to get both the first and second doses. We did see a good uptake at the beginning of first doses, and we're seeing that in some age groups more than others, and I'll turn it over to Minister Dix to give you some of those details. But we also see that through the summer, as case rates were coming down, that sense of urgency was going down. We were getting that large group of people who were eligible for their second doses immunized. Our immunization clinics were really, really busy. And now we're at that point. As I've said, in the last couple of weeks, we have a lot of vaccine now. We have a lot of access. We need to get over that complacency and recognize that as we go into the fall, as we're seeing case rates come up, particularly in pockets where there's still people unimmunized, that this is our time to step up again and to get younger people. Most of the cases that we're seeing are people who are unvaccinated between the ages of 20 and 40. So we will be making sure that 12 to 17-year-olds have access, and we're working on the plans for schools. We're working with the advanced education sector to make sure that international students and other students going to university this fall can have access to vaccine on campus easily and quickly for them, and that's what this will help support in the next little while. So yes, now is the time. I know people have been busy, they've been doing things through the summer, and in parts of this province we've had a lot of displacement from all kinds of things going on. But now's the time to pay attention so that we're all protected as we go into the fall.
Thank you for the question, Camille. I don't think that's what we see in general. What you see right now, 83.2% of people with their first dose, 74.9% with their second dose. There is of course an interval between those doses. So the number of people who require a second dose is and have had their first dose down to 386,000, and that's a relatively small number. Only 1 in 12 people are in the partially vaccinated category. So we haven't seen generally that as the problem. And the question of age is also a little bit inconsistent throughout the province. As we've said a number of times, over 50. Generally speaking, whether you're in Northern Health or Interior Health or Vancouver Coastal Health or Island Health or Fraser Health, your levels of vaccination are pretty comparable, within a few percentage points in those categories. It's where we get under 50 that there's very significant differences as between health authorities, and we're obviously significantly focused on that to make it happen. But with respect to second dose immunization, generally speaking, that's happening. The people who choose to get first doses are getting second doses with relatively little delay. And right now, if you count those who are registered for their second dose, it's a declining amount. It's 8% now. We expect it to continue to drop. It won't go down to zero, that gap, because by definition, people who had their first dose, say yesterday, will have to wait a period of time to get their second dose. But that gap is dropping. It'll be 8% as of end of day today, and it'll continue to drop in the coming days and weeks. So we don't see that as a problem. What we want to do is get more people with their first dose immunization, because that across the board leads to the second dose, of course.
Follow-up, Camille?
Yes, thank you. For the vaccination cards, what can you say about whether the technology that's being used so that people can't forge them?
Well, the work is being done inside government for a safe porthole so that this information, and it's not about details, health details, other than whether or not you've been immunized. So we're doing our best, working with the Privacy Commissioner and his staff, working within government with the people who work with technologies every day, overlaying that with the good work at the Public Health Office and in Minister Dix's ministry to make sure that we can narrow down this technology to this one specific purpose. We are confident that we've got there. And as we roll it out in September, that'll be obvious to most people that this is, if you have the technology, and the vast majority of people do, on their phone, they can download that information and then apply it to whatever venue they want to enter. And we're hopeful that this is going to be as seamless as we can make it. Again, looking at other jurisdictions, following their lead, keeping in mind the privacy concerns of British Columbians, as well as the increase in technological use by the vast majority of British Columbians. And those who can't, as Dr. Henry and Minister Dix have said, there'll be other mechanisms for them to get that information to demonstrate that they can attend the events that they want to attend.
Next question is from Rob Monroe, Info News.
Hi, Dr. Henry. Thank you for this. I'm just wondering how this affects the measures that were brought into place in the Interior Health Region. Does that mean in September we will be able to relax some of those measures, or is that lockdown going to continue?
Yeah, so that's a really good question. And there is some discretion for areas of high transmission, and the Interior Health is one of them, where we'll be having discussions about whether we can put some of these measures in place sooner rather than later. So we may use it as an opportunity to test some of the vaccine card initiative. We've been having some early conversations about that. And yes, that should allow us to have some of these gatherings, events happen more safely in those areas where we already have higher transmission. But in the meantime, we need to continue to take those other measures that protect us in the interior. We know that a lot of the transmission is happening in indoor social gatherings, and so private gatherings especially. So making sure that we do take that step of getting vaccinated now. And it will have a more impact in the next little while. But the local MHO can bring in some of these restrictions earlier, or some of these requirements earlier, and we'll be talking about how we can do that to support things getting back to more normal in the interior in the next little while.
Rob, do you have a follow-up?
Yeah, just to clarify, so does this mean by September the 13th we will have access in the interior to these, or are you suggesting we might have it even a week or two earlier?
We might have it earlier, or we might have ways of doing it, for example, showing your immunization card in certain situations. So we're working through some of those details in the higher risk communities.
Lisa Euston, News 1130.
Hi there. I'm trying to roll two into one here. Premier, I didn't quite hear the answer to forging and what will prevent forging of this kind of technology. And also, is there any option for a negative COVID test for people who aren't vaccinated?
Yeah, no, we're not including COVID testing results in the vaccine card. It really is about immunization, and we know that even people who have had COVID-19, the immunity that you have is less broad and less, we don't know how long it lasts for some people. It fades away quite quickly. So immunization is still important, particularly for people who've had mild cases of COVID.
And with respect to the protection that citizens will have through the app that will be, or the technology that will ultimately be laid out for everyone on the 13th of September, we've taken steps, and government is quite proficient at this. Oftentimes there are reports of governments, not just ours, but others being hacked by malicious individuals or groups. And that's a constant concern within government for technologies. So we have pretty sophisticated personnel that manage these issues, not just within health, but also right across government. And we're confident that every tool that we can use to protect this information and to make sure it can't be duplicated or forged will be put in place, and we'll see how we unroll it on the 13th, and we can be judged at that time.
Follow-up, Lisa?
Yes, wondering what your concerns are about facing legal challenges for this, and also are churches and mosques and other religious facilities included in requiring this proof of vaccine?
Well, with respect to legal challenges, again, I just point, as Minister Dix has said, 83% first dose, 75% second dose. British Columbians in the majority are very much supportive of this initiative, and quite frankly, I've heard more than anything else, what's keeping you back? What's holding you up? Why are we not doing this right now? That, having said that, there will be those that will challenge the application, and we'll take that on as it comes. I don't want to prejudge or predict who or what or how that will happen, but again, government is always prepared for these types of adventures into the courts. We do it all the time. The Minister of Attorney General is well versed at managing these issues as they come forward, and I'm confident that this is no different than those. Sure. Oh, yeah.
No, these will not be applying to faith-based services, nor will it apply to essential services like healthcare services. It also, as you can see, doesn't apply to retail and grocery stores, areas where we don't see a lot of transmission and where we have other measures in place, and they are essential services. What it applies to is those discretionary, those social events, the arts, the sports, the things that we want to and need to get back to, but can be a risk. So indoor group environments, and that's why we've picked the places that we have, because these are discretionary. They are not essential services. I've worked, as you know, we've worked really closely with the faith-based groups across the province over this past very long year and a half, and we have in place guidelines that they are using to help support faith-based services coming back to some in-person and hybrids, and there's a lot of work that's been done with the communities to make sure that they can continue to operate safely, and we're seeing that as being effective.
Rob Buffum, CTVVI.
Oh, thank you for taking my question. My first question is for Premier Horgan, and it actually relates to Fairy Creek. Over the weekend, video emerged that you may have seen showing the RCMP spraying protesters there. The protesters are now alleging excessive force by the RCMP. This question is for a colleague who's wondering, you know, so far things don't seem to be tamping down what appears to be maybe escalating conflict out there. What's your reaction, and do you have a solution apart from what's currently going on?
Well, with respect to the issue of old growth logging in British Columbia, this is something that didn't just start 6 weeks ago, 6 months ago, 6 years ago. It has been part and parcel of our forest industry from the beginning. And since we were sworn in as a government, we've taken extraordinary steps to protect old growth forests, to the point of striking an independent commission who brought forward recommendations, which we in September fully embraced and have been working on implementing from that time. At the core, of course, is also the Declaration on the Rights of Indigenous People who have been here since the beginning of time, and it is on their territory that much of this activity takes place. Whether it's been ceded or unceded, those discussions need to take place, and they have been ongoing. With respect to the Pachidat and Fairy Creek, the Pachidat have said quite clearly, not once, not twice, not 3 times, but 5 times, please leave our territory and allow us to resolve these issues on our land in our way. To that end, the Pachidat have deferred all logging, old growth logging in Fairy Creek. So the objective that the protesters set out to achieve appears to me to have been achieved. And at this point, they're continuing to stay in the territory against the wishes of the Pachidat, against the injunction that was brought forward by the courts. And law enforcement doesn't take direction from government. They make their choices based on how the courts direct them, and they've been directed to enforce the injunction. I would prefer that the confrontation would come to an end and we can get back to the collaboration that we've seen in so many other endeavors in our lives here in British Columbia as a result of COVID. We've made great progress on deferring massive tracts of old growth forests. We have much more to do, and I would rather do that, as we are with many organizations across the province, in a collaborative way rather than in a confrontational way.
Rob, do you have a follow-up?
I do. This is for another colleague, and it's for Minister Dix. It relates to healthcare here on the island. Over the weekend, Minister Dix, as you probably know, Saanich Peninsula ER's department was shut down at one point overnight, apparently because of staffing issues, and people were directed to go to other hospitals, including, we've heard, Vic General had very long waits, up to 11 hours. So I guess I'm hoping to get your thoughts on what this says about the state of healthcare if an emergency room department on Vancouver Island is shut down overnight and patients are turned away, and how worried you are about that.
Well, in this case, I mean, obviously we don't like it, and we don't see that in any way as desirable. In this case, it was deemed for the safety of all patients that would be the right approach, that we divert patients to the other hospitals in the region, and that's what's happened. And it's obviously not desirable, but you have to make sure that you are appropriately staffed in those circumstances. It doesn't happen very often, but it happened in this case, and it does show in this time, and it's why this time, which is particularly challenging in our hospital system, where we're seeing a high response and a high use of emergency health services, in relative terms the highest use ever in calls to the BC Emergency Health Service, to the ambulance service, when we're seeing relatively high uses of emergency rooms, when we see the challenges with respect to the Delta variant in terms of COVID-19, there are real challenges in healthcare. And I think our teams are doing a really good job. They determined at Vancouver Island Health this decision was needed on that day. It's not desirable, but it was the right decision for the safety of patients and to provide the right care to patients. And they took that decision, and I support them in taking that decision. But obviously, these are issues we work on to avoid and to ensure that this would happen very, very rarely. So I think it's certainly a significant concern to me. Obviously, we weren't happy that it had to be done, but it needed to be done in those circumstances, and I think folks did the right job. And hopefully, and as you know, in emergency rooms, it's why we provided alternatives, why the important role played by urgent and primary care centers and by excellent primary care around the province so important, particularly in these times, that patients are triaged. So some patients obviously get seen immediately, and that's inevitable, and some have to wait longer. But we're not happy about it. We certainly hope it doesn't happen again. It was deemed necessary at the time, and but I think in general, across the board, our healthcare teams are doing an extraordinary job under very difficult circumstances. 2 public health emergencies right now, the overdose public health emergency, the COVID-19 public health emergency, and a significant increase in utilization of services. And I think our healthcare teams are just doing an exceptional job. And sometimes tough decisions have to be made in the moment as a result of that. But we're going to continue to do everything we can to provide the level of service necessary.
Marcia Lederman, Global Mail.
Hi there. Thanks for taking my question. You indicated earlier that it's a different process when it comes to the employer-employee relationship. BC is obviously an employer. So what about for provincial government employees? Will a vaccine be required for them to go to their jobs?
Thank you very much for the question, Marcia. I think those are things, obviously, the government looks at right now within the provincial sphere. We're implementing a requirement for vaccination for long-term care workers and assisted living workers, and obviously we're looking to move more broadly within the healthcare system. Why have we started there? Because that's clearly where the highest level of risk is. We've seen the significant number of people who've passed away in long-term care in the hundreds in British Columbia, and so the risk there is significant, and it's why we're moving first to mandatory vaccination. And that risk is also supports the decision in that area to go to mandatory vaccination. So the other areas, of course, we are looking at based on the same principles. But right now, at present, we're going first, and this is by October 12th, to ensure that everybody who works in long-term care and assisted living is vaccinated. And we'll look at other issues, especially in healthcare, which is my principal concern as Minister of Health in the coming days.
Follow up, Marsha?
I was having trouble understanding what happens if someone from another province comes to BC and wants to go to a restaurant or wants to go to a play or concert. Will they be able to, and what will they have to show for proof?
So we're going to work through province by province. Some provinces already have equivalent identification of different sorts now. And so we'll be working through those issues with other provinces and be able to provide and support businesses in the coming week. Of course, this is coming into place September 13th. So in advance of that, where we not only provide what people can expect from British Columbians, but what they could expect from other people from other provinces in Canada.
We have time for one more question today. Katie Nicholson, CBC.
Thank you. I'm hoping to get responses in French and English, if possible. One point, just looking for some more clarification. Dr. Henry, you mentioned this is a limited time requirement, but we'd like to know how long is limited. If you're suggesting that those who can't be vaccinated for medical reasons just won't be able to attend events like this while proof of vaccination is a requirement, how long will they have to wait?
You know, our intent right now is to be looking at January and reassessing as we go through the fall, as we see what happens as we increase, incrementally increasing just a small amount. The number of people who are vaccinated makes a big difference in how we can protect people. So we are looking at January. But we'll be reassessing on a month-by-month basis as we go through the fall.
Oui, effectivement, on va continuer avec ces mesures jusqu'au mois de janvier. Et puis après, on va considérer nos options, bien entendu. Ça n'indique pas pour automne qu'on va changer le mois de janvier, mais qu'on va reconsidérer tout cela. Mais pour le moment, il est essentiel dans ces activités discrétionnaires qu'il faut être vacciné en Colombie-Britannique. Et c'est pour la protection des gens, c'est pour la protection des travailleurs, c'est pour la protection de tout le monde. Et donc, il est essentiel pendant cette période de l'automne jusqu'en hiver, qu'on a cette obligation d'être vacciné pour participer à ces activités qui ne sont pas essentielles, mais qui sont importantes, bien entendu, mais pas essentielles pendant cette période. Je sais que c'est difficile pour certaines personnes, mais il s'agit d'une période très difficile, avec beaucoup d'inconnus, et il faut, en premier lieu, protéger la santé des gens en Colombie-Britannique, et c'est cela qu'on a l'intention de faire.
Katie, do you have a follow-up?
Yes, and again, I would have the same ask in both French and English. Just looking at sort of how this is supposed to roll out and how people can access the data, is there a fear that this gives preference to people who can afford phones and who have, fixed address, that sort of thing? How will all people be able to access this vaccine card if you don't have a phone, if you don't have a fixed address?
So the vast majority of people will have a phone and will have access to that. There is a second option, and there will be a second option to support other people that will be available via phone, essentially, for people who are not in those circumstances. So obviously, a lot of the work that needs to be done in this area is based on those people who aren't in those circumstances. And we want to make sure, of course, this is fair for everyone, because we need everyone to be vaccinated. And we want everyone, of course, once they're vaccinated, to be able to have every opportunity to take part in these activities. Je dirais en français que c'est bien entendu une priorité pour nous d'avoir que tout le monde téléphone cellulaire ou pas, d'avoir accès à leurs droits comme citoyens. Si on est vacciné, on peut participer à toutes ces activités. Donc, une grande partie de notre travail, c'est d'assurer que des autres personnes qui ne sont pas dans des catégories qui peuvent avoir accès facilement à ces renseignements, à leurs propres renseignements, sont en mesure d'en avoir accès. Donc, on va travailler là-dessus, on va présenter ces renseignements bien en avant du 13 septembre pour donner l'opportunité à tout le monde de pouvoir participer à ces activités, sauf que, et pour assurer, mais sûrement, s'ils sont vaccinés. Donc, c'est important d'être vacciné en Colombie-Britannique pour participer à ces activités qui ne sont pas essentielles, mais importantes. Merci beaucoup. Thank you very much.